Let me tell you about a patient, not one particular patient, but a patient I meet almost every week. She is usually in her 50s, a little overweight, her knees are stiff, they hurt climbing stairs, getting up from a chair has become difficult. She's already tried painkillers, physiotherapy, perhaps even an injection. She places a thick file of reports on my desk and says, Doctor, they have told me everything is normal. Her HbA1c is normal. Her cholesterol is acceptable. Sometimes even her inflammatory markers are only mildly elevated. Yet her arthritis keeps getting worse. Then she asks me the same questions I hear again and again. Doctor, if everything is normal, why is my knee still getting worse? Over the last few years, I've realized something. The answer isn't simply in the x ray, it's hidden in the biology of the joint. And that's exactly what this video is about. It isn't wear and tear, it's biology. To answer our question, I first have to change the question. The real question isn't why is this knee wearing out? The real question is why is this knee still inflamed? For years, we've described osteoarthritis as wear and tear. I've never been completely satisfied with that explanation. Think about it. A worn tire doesn't become hot, a worn door hinge doesn't swell, it doesn't fill itself with inflammatory fluid, but an arthritic knee does. It becomes warm, it swells, it fills with fluid. Those are not simply the signs of something worn out. They are the signs of something biologically active. Something inside that knee is still happening. Something is keeping a fire alive. When I explain this to my Tamil speaking patients, I don't use complicated medical words. I simply tell them, உங்கள் மூட்டுக்குள் ஒரு எரிச்சல் தொடர்ந்து எரிந்து கொண்டிருக்கிறது. A fire keeps burning inside your knee joint. மூட்டுக்குள் எரிச்சல். The fire inside the joint. A persistent biological fire inside the joint. Not a fire you can see, but one that quietly damages the knee over months and years. The problem isn't that the fire started. The problem is it never completely went out. Where explains the damage? Biology explains why the damage continues. To understand that fire, you first have to understand inflammation. Most people think inflammation is the enemy. It isn't. Every injury you've ever had began with inflammation. A cut finger, a twisted ankle, a fall from a bicycle. Within minutes, your body sends in its repair team. Damaged tissue is removed, debris is cleared, other repair cells are called in, the fire brigade arrives exactly as it should. Without inflammation, none of us would ever heal. So, inflammation starting is not the problem. The problem is stranger. The fire brigade never went home. In a healthy injury, the alarm rings, the repair team arrives, the damage is cleared, the alarm switches off. Everyone goes home. But in osteoarthritis, that second step doesn't happen properly. The inflammation didn't fail to start, it failed to finish. And a fire that is never told to stop can burn quietly for years. That is மூட்டுக்குள் எரிச்சல். So, who helps bring that fire under control? Let me introduce you to one of the body's most important maintenance engineers. Doctors call it a macrophage. Don't worry about the name. Think of it simply as one of the cells that helps coordinate healing. It spends its life quietly patrolling your tissues, cleaning away damaged cells, removing debris, helping protect the joint. But perhaps its most remarkable job is something else. It is constantly listening to the chemical messages around it. Those messages help determine whether the joint still needs an emergency response or whether it is finally time to let healing settle down. In a healthy joint, as healing progresses, the biological messages begin to change. The repair cells gradually help bring the inflammation towards its natural end. Balance is restored. Life moves on. But an arthritic knee is different. Damaged cartilage continuously releases tiny fragments. The tissues around the joint release distress signals. Those messages keep telling the macrophages, danger is still here. So the repair cell continues behaving as though the emergency is still happening. Not because the macrophage is faulty, but it continues to receive messages that keep it trapped in an inflammatory environment. The problem is not simply the cell. The problem is a biological environment, and that changes the way we think about osteoarthritis. The knee listens to the whole body. Here is another important lesson. Those danger signals don't come only from the knee. The knee has its own signals, but in many patients, those signals are amplified by what is happening elsewhere in the body. Visceral fat, the fat packed around the organs inside the abdomen, is not simply stored energy. It is biologically active. It constantly communicates with the immune system. A fatty liver often reflects that same altered biological environment. Different organs, one biological conversation. The macrophage inside the knee listens to all of it. The knee is not an isolated joint, it is listening to the whole body. If the body continues sending danger signals, the knee continues receiving them. Exactly how obesity, fatty liver, and metabolism contribute to this conversation deserves a separate discussion. I've made dedicated videos on those topics. Today's message is simpler. Your knee doesn't exist in isolation. It is part of your whole body's biology. Now come back to the lady sitting across from me. Her x-ray shows the damage, the narrowed joint space, the bone spurs, the bone cartilage. But an x-ray is only a photograph. It shows me the wear. It cannot show me the biology. It cannot show me the fire. It cannot tell me what is feeding it. So when she places her reports on my desk, I don't stop at the x-ray. I start asking different questions. Not simply how worn is the joint, but why is this knee still inflamed? Or as I explained to my Tamil speaking patients, இந்த மூட்டுக்குள்ள எரிச்சல் தொடர்ந்து வைத்திருப்பது என்ன? What is keeping this fire inside the joint alive? What is keeping this biological fire alive? I don't begin by asking which injection should I give. I begin by asking what is driving this patient's arthritis. Is it mechanical overload, persistent synovitis, the bone beneath the cartilage, the meniscus, visceral fat, fatty liver, or several of these together? Because if I read only the x-ray, I treat the wear. If I understand the biology, I can identify what is driving the destruction. That is the difference between looking at a knee and understanding it. And once we understand what is feeding the fire, only then does it make sense to talk about treatment. So we are left with one important question. If these repair cells continue receiving messages that keep the fire alive, can we change that biological environment? Can we help the joint return towards balance? Can we calm this மூட்டுக்குள் எரிச்சல், the fire inside the joint, without simply masking the pain? That question changed the way scientists think about stem cells. And it changed the way I think about joint preservation. That's exactly what we'll discuss in my next video. What stem cells actually do and what they don't. If your knee is swollen, stiff, or you've been told it's just age, don't stop with the x-ray. Ask another question. Why is my knee still inflamed? Or better still, why does this மூட்டுக்கு உள்ள எரிச்சல் continue? Because before we choose the treatment, we first have to understand the biology. I am Dr. A.K. Venkatachalam. Thank you for watching. I'll see you in the next video.